Hey, y'all, welcome to another episode of Confessions of a Male Gynecologist. I want to talk about something that I think is super important, and that is the overdosage of hormones and women using hormones. And I think the reason that this bothers me so much is that it's totally rampant. And I've been looking at this now for years, and what I have found is that there is a place that is training women on, are not training just women, but they're training people, providers in this manner of overdosage. I find this time and time again where people that are overdosing on testosterone and estrogen and progesterone are coming from this place called WorldLink Medical. And what I would challenge you guys to do is to ask your providers. I think it's really interesting to find this out too. Like, ask them kind of where you got your training. So, like for me, if you said to me on a visit, Dr. Tassone, where did you get your training on hormones? I could say, well, I did, my 4 years of medical school, which probably didn't have a whole lot of hormones, but set the base. Then I did a residency in OBGYN for 4 years, which did include a lot on hormones. And then I practiced for 20 years, and 15 of those years were using bioidentical HRT. I've seen 50,000 patients, blah, blah, blah. That would be a super amazing way to look at things. But if you had a provider that said to you, well, I did, some training, and keep in mind, they should be very open about this. They should be very proud of where they got their training. They should be very proud of their backgrounds. Whenever you see a provider out there saying, oh, I'm doctor this and I'm doctor that, but you can't find out what kind of doctor they are, even though you've gone to their website and you've looked for 10 minutes and you still cannot figure out what type of doctor they are. Keep this in mind, because there's a lot of people out there that hide the fact that they have a doctorate in physical therapy or not. And I'm not saying that that's a bad thing. I'm just saying that's not hormones. They obviously didn't learn squat about hormones in their training, and what they've learned from courses. So there's this crazy doctorate of pastoral medicine, and there's a charlatan out there right now who, Dan Pompa, who lost his chiropractic license for various reasons. And so he could still call himself a doctor. He went and got one of these token garbage PhD or doctorates of pastoral sciences. So he can say he's a doctor, but he doesn't ever say what kind of a doctor he is. And so you want to know this. You want to know what kind of doctor they are. You want to know where they trained, and they should be forthcoming with that, because if they're proud of what they've done and if they're proud of their training, then that just makes sense that they would be like I just did. I'm more than happy to tell you where I trained. So there's this place online that I see a lot of doctors talking about, and they say they've got their training at WorldLink Medical. WorldLink Medical is basically run by a man named Neil Rosier. And Neil is been in this hormone space for a long time. I don't really think he sees any patients, but he teaches, these things, and he's the medical director for some preventive medicine clinics, which basically, in my opinion, doesn't do anything. He's probably not seeing the patient. He's probably trained people. But anyways, when he trains people on how to do things, he is the main offender at training these folks on overdosage. And I just see this over and over and over again. And it's ridiculous. I mean, he has been, I believe, on the faculty at basically many places. A lot of them are Pellets. He had a legal dispute versus BioT, which is one of the main offenders, I feel, in the hormone space. They had a big lawsuit, he and BioT. So Neil Rosier, who is, in my opinion, the main offender of women being overdosed on hormones. I just saw a lady yesterday who is on a dose of testosterone of 80 milligrams. I usually put women on 3 milligrams if I do oral. And this man teaches doctors that it's okay to put them on 80, which is what, almost 30 times the dose. Just completely ridiculous. And naturally, her testosterone levels were probably higher than her husband. So he basically is somebody that has, come up with a lot of the pellet therapies. And but anyways, BioT sued him, asserting claims for basically breach of fiduciary duty, misappropriation of trade secrets, and common law misappropriations. And this is kind of my interpretation, but this was only 6 years ago. He stopped working in 2018 for BioT, and BioT then turned around and said that Rosier was lured away by a competitor called Evexipel. Evexipel, to me, is another company that is complete trash. They train providers all the time. They'll train anybody. They'll train somebody that's working at a med spa or a plastic surgeon's office. They don't care. And if you follow Evexipel on Instagram, you'll see all these rooms filled with people that are taking their courses, and they are just teaching in mass. The doctor that wrote the book for their hormone course isn't even a hormone expert. Blah blah blah, same old thing. But basically, what happened was Rosier stole the trade secrets from BioT and brought them to Evexipel, and so it's already, in my opinion, based in legal crap, and the whole thing just stinks and reeks of misappropriation and unethical behaviors. And as you know, I think that pellets are unethical. Basically, the whole point of this is that the whole thing is just steeped in complete garbage. And he does teach. He teaches overdoses. I've seen so many people that have been treated by someone that was trained by him or in his methods, and they're all overdosed. Basically, he is teaching people all the time. And it's one of those things where these hormone therapy clinics that he started and started training people on, I'm not against treating patients if their levels are normal, as you're well aware. I think that normal is a range. I think that normal, there's low normal, there's high normal, but it's still normal. And what I would say is that as long as you're in the normal range, you should be up around the high end of normal. Now, he thinks that you can have a level that's 6 times normal and that's fine. I think that that's unfortunate and that's inappropriate. But it's one of those things where so here's, again, this is my point. When you meet with somebody, I think you should sit down with them and ask them, who and where did you train? How did you get your hormonal background? First of all, they should say, if you're a doctor, what kind of doctor are you? If you are a doctor, where did you get your training from for hormones? And it's one of those things where I really am curious as to how they would respond. If they respond with defense, if they respond with offense, then you know that there's a reason for that. And I just think it's inappropriate. It's one of those things where I think you should understand what their training is and where they're getting their program from. Because in my case, I know that if they were trained by this guy, Neil Rosier, that they overdosed. It's like if I train somebody, you know that they don't overdose, and you know that they hate pellets, because I wouldn't train someone and endorse them if they use pellets. I just simply wouldn't do it. And so it's one of those things where you have to look at this guy. Now, Neil Rosier, by training, was an emergency room physician. Where he got his training on hormones, I don't know. Where he learned on patients, I don't know. And it's one of those things. If you type in Neil Rosier on Instagram or on, if you look at his background on the internet, you'll find a lot of things. He's bounced around quite a bit. He's trained people that have been sued. He's been sued. The whole thing is just steeped in unethicality and other issues that I just kind of feel like it's one of those things where it's like the farther you dig, you'll find this pedigree where all of these people were trained under the same kind of umbrella and under the same program, where I just think that what you're getting is unethical behaviors and something whereby I just personally don't agree with the way that these people do things. And it's one of those things where it's all about money. And if you go to Evexipel, Evexipel, and you look at them on Instagram and you look at this room, you're going to see if you look at their lectures, basically what they're talking about is money. They talk about the industry, how much money there is to be made. And all these people there are in it for the money. There's nothing in this about patients living their best lives. They'll say this, but there's nothing about overdosing somebody on any medication that is considered ethical, in my opinion. And I just think that you need to do your due diligence. And it's one of those things where if you don't do your due diligence, you're going to figure out quickly that you're going to get injured. And so it's one of those things where you need to look at the training of the person that's looking at you. And, you trust the system, you trust the medical boards, you trust human beings. But let's take a look at this. Let's look at this case against Neil. And basically, like I said, he worked for BioT, which in my opinion is one of the worst offenders in the hormone pellet space. He was a faculty member who trained doctors and their staff on hormone replacement therapy. Now I think he works with Evexipel. Like I said, he may have left that since then. I don't really know. I don't follow him too closely. But basically what he did was he came up with their systems, and BioT provided Dr. Neil with its confidentiality and proprietary information when he worked for them, obviously. Sometime in 2018, Dr. Rosier stopped performing work for BioT and began working in the same capacity at Evexipel, which is actually a competitor of BioT. Both companies are complete trash, in my opinion. And he worked in that same context. He made courses for them. He developed programs and protocols for them. And BioT subsequently filed a suit alleging, amongst other claims, that there was a misappropriation of trade secrets and alleging that Rosier and Evexipel were using BioT's stolen intellectual property to compete with BioT, which, in my opinion, is completely unethical, obviously. The ruling that they came with on November 2019, the Dallas Court of Appeals affirmed the trial court's denial of Rosier tried to dismiss. They found that there was a relevant part that BioT established themselves, and in so doing, the appellate court noted that Dr. Rosier's role at BioT had a sales component to it. He not only trained doctors and their staff on hormone therapy system, but he also provided information on how to answer patient questions and how to market the hormone therapy system. You see, because it's all about marketing. It's not about you feeling better. It's about them getting money in their pockets. And then moreover, after completing the training, the doctors would sign up to be providers of the BioT system. As I have told you in previous podcasts, the Pellet system is a pay-to-play operation. Not only do you have to pay to play, but the way these companies make their money off of you is through pellet sales, right? So the doctor that's making the money is already tied to the sale of the pellets. So when they tell you things, and I can't tell you how many excuses I've heard for doctors that sell pellets, it's one of those things where, doctors will say, oh, testosterone doesn't absorb, or, oh, hormones won't absorb. There's no way you should take it this way, because they're pushing you towards their pocket lining. But anyways, it's all about money. And when you watch videos of, like I said, of the training program, it's all about money. They talk about money. They talk about how big the industry is and blah, blah, blah. Now, don't get me wrong. I make money when I see patients, but I don't make money on the prescriptions. To me, that's unethical. And that's what happens, I believe, in pellet therapy, is the doctor should be required to tell you that they are making money off of this pellet and that there are other options. But what they're doing is they're not telling you about the other options. They're lying about the other options because they want to move you towards the pellet. And to me, that's completely unethical. So basically, what they found was BioT's allegations that Dr. Rosier communicated with physicians for the purpose of promoting the use of Evexipel systems was alone sufficient to demonstrate that his communications were made while he was primarily engaged in the business of selling goods. He had an argument back, and basically it's like the whole thing, it's just steeped in unethical behaviors. I just don't see how this can make somebody feel good when you know it's steeped in unethical behaviors. And if the program is based on unethical behaviors because the people were unethical, then how can this be something that is used for a patient? And let's just kind of reiterate what I see in my practice with hormonal pellets. Usually, I'd probably say 9 out of 10 times, the pellets that are placed with just testosterone, although occasionally you'll see somebody with estrogen. And again, they overdose you on the estrogen piece. Even these people who use, like, say, oral progesterone, they overdose people on progesterone. A standard dose of progesterone is 100. Some patients need 200, but sometimes I see patients on 900. And these are people that trained with this guy. I can't tell you, there's a practitioner in Minnesota that I have seen probably 5 of the patients that she has seen, and every single one of them was massively overdosed. And those 5 patients simply cannot be outliers. If this person is treating them with these protocols that she learned from these guys, then the problem is that it's the training, it's not the provider. And why doctors believe that it's okay to overdose people, I have no idea. It's one of those things where I believe that we as people try to give folks the benefit of the doubt, and I just wouldn't do that. I mean, I know it's tough to have a system where you can't trust people because you just don't know them very well. And that's true. I do think that it's one of those things that we have to look at and say, well, do we trust this person? Do we trust the FDA? It's tough because we want to trust people. We want to think that what we're getting is, their best foot forward, and not that they are having unethical behaviors. And so I think this is the steps I would take when you are vetting your hormone replacement person. Number 1 would be to ask them where they got trained. And like I said, they should be proud of that. They should be happy about that. They should want to tell you, man, I got the best training ever, and whatever it is. Number 2, ask them what their background is. What are you a doctor of? I'm sorry, but if they tell you that they are, say, a nurse practitioner and they were hired by so-and-so, like let's say I had a nurse practitioner or a PA, and they were under me and they were working with me, they could say, yeah, I work with Dr. Tassone. He oversees what I do. He taught me how to do what he does. Okay. But if you are training with someone that's teaching poorly or that teaches inappropriate concepts, then shit rolls downhill, right? So you want to see what their training is. Now, if they're a physician or a doctor, what type of doctor are you? And there's nothing wrong with asking that. If you were going to have a surgery, if you were going to have, say, your gallbladder removed, you would want to know you're getting treated by a general surgeon. If somebody came up to you and said, oh, I'm Dr. So-and-so, and I'm going to remove your gallbladder, and then you couldn't figure out what type of doctor they were. Maybe they're a chiropractor, maybe they're a doctor of pastoral medicine, maybe they're a doctor of physical therapy. You would want to know that, because I wouldn't let one of them cut on me. So why would you let one of them manage your hormones? If somebody's an ER doc, they can learn hormones. I get that, but they're dabbling. It's not what they've done for 20 years. They are dabbling and they're experimenting on you. And I just don't like that. And you see this more in the alternative community. You see this experimentation of patients. Like the big thing right now is this microdosing of semaglutide. And who knows, maybe microdosing of semaglutide will come out to be a thing. The problem is that it's experimental. And it's one of those things whereby they are experimenting on you. Worst case, and they always say this because I see this in the Facebook pages. Well, because I mentioned this the other day, you're experimenting on patients, and they get all butthurt and offended that I would bring that up. But the point is, they are, because it's not a thing. And their retort to me is, well, worst case scenario is it doesn't work. Okay, well, what are they paying for then if it doesn't work? And if you think that it might not work, are you telling patients that when they're dropping money on your program? And now there's somebody out there training people on microdosing. It's not even a thing. And yet she's out there training people. So come on. I mean, can we just be honest about stuff? I know it's all about going on podcasts and being popular and blah, blah, blah. But it's also about ethicality, being honest, being open, and telling people. And to me, it all comes back to the same thing, that it's one of those deals where you have to, again, do the work, because nobody is going to be there for you. Nobody's going to vet that for you. And I see this all the time because I hear it all the time. I hear women that are being basically lied to all the time. They're being told things that aren't true. And it's all for money. And it's really unfortunate. It makes me feel badly. I wouldn't do that. I would not promote something. I would not tell you something if I didn't firmly believe in it. And it's kind of like these foodies that are out there on Instagram. And if you notice, these foodies, especially like, say, the ones that talk from Austin, every restaurant they go to is literally the best restaurant they've ever been to, right? And I've often commented, like, if this is a paid for endorsement, meaning they gave you the food, like if you got the free food to go there and then talk about their food. Now, it's one thing, you may really like the food, but you can't like every restaurant you go to. It's just simply impossible. And if they are giving you the food for free, you should have to be transparent and say, basically, this is a paid endorsement, because it is paid. They're paying you with food. The problem that I have is these foodies, they will not disclose this. And this is the other thing I say. There's Casey Means is a doctor out there who wrote a book on energy, and it's been pretty popular. And she's pushing, products left and right. Like this is a formula. You write a book, you push a bunch of products, but she will not say that it's a paid endorsement. And it's obviously a paid endorsement, because she wouldn't be doing it. I mean, you wouldn't be out there doing it. And I will tell you if I'm not getting paid. I'll tell you if I'm getting paid, whatever. I travel around the country and I train other doctors on how to perform a fibroid surgery called Accessa. And when the company sends me to train a doctor, they're obviously paying me. But I believe in the procedure, or I wouldn't be supporting it. And I think, here's the thing. Dr. Means might be support of MitoPure. She might believe in MitoPure, but I think it undermines your credibility when you don't disclaim that you have a financial relationship with these companies. And I think that pellet people should be held to the fire, and they should have to say, look, you can pay me $1,200 and I'll put these pellets in every 3 months. Or you can also try a cream that's $40 a month, and you'll probably get very similar results. And guess what? Your results won't be through the roof, and you won't go through the stratosphere. Now, if they did that, my guess is that you would probably opt for the cream, because who wouldn't want to pay $120 versus $1,000, over a 3-month span? And then it's like, okay, well, when we put you on these pellets, we have to also put you on spironolactone or anastrozole because your testosterone levels are going to be so high. We want to prevent the conversion. Now, BioT, in all of their geniusness, which they're marketing geniuses, I'll give them that, they came out with a supplement line. So every time I see somebody on BioT, they'll get DIM. And I've talked about DIM in the past. They think that the high levels of, here's their thought process, high level of testosterone turns into estrogen. We've got to then lower the estrogen levels because the testosterone is going to convert into estrogen. Or we pumped you so full of estrogen with our pellet, we need to help you get rid of it. It's like, why are you giving me another medication or selling me a supplement to counteract the overdose that you just gave me? To me, again, that's unethical. So let's go through this. How do you vet your provider? Number one, ask them where they got their hormone training. Number two, ask them what kind of provider they are. Like, what's your background? Like, you know, like in my case, I have gray hair, obviously been in practice a while. What did you train in? What's your background? Well, I'm an OBGYN. Where did you get your hormonal background? Well, I trained in OBGYN as a resident. I've been practicing for 20 years. I've treated 50,000 women, wrote the book, The Hormone Balance Bible. Okay, you have it there. If you went into somebody's office and they were claiming to be the hormone guru or the hormone expert, whatever, and you ask them these questions, where did you get your hormone training? Oh, I went to WorldLink. Oh, well, then you know right away they're overdosing you. Oh, I did my training with A4M, or I did my training. Basically, the people that are doing these trainings are teaching them protocols because most of these folks that are pushing pellets can't think for themselves. And what they do is they'll draw your labs, they'll put them into the grinder, and it'll come out with a plan. And that's what they do. There's no thought there. There's no thought process. The only thought process is then how much can I make by selling you a supplement, having you come back every 3 months, overdosing you, you know, blah, blah, blah. This is the formula. So what I would say is you want to make sure that you know who they are, where they trained, what their background is. And then you can also ask questions about their belief structure. Like, do you think it's okay to overdose testosterone? Do you think it's okay to overdose on estrogen, and why? Why do you think it's okay to give 900 milligrams of progesterone when the standard dose is 100 or 200? Why do you think it's okay to have my testosterone level at 350 when the normal range is 0 to 54? Ask those questions. And then when they turn around and get defensive or offensive, then you have your answer. Because if they can't defend what they do, doctors should always be able to defend what they do. I did a surgery yesterday. I took out a 8 centimeter fibroid in a 35-year-old woman. Was I able to defend that? Of course. I gave her 6 options, from doing absolutely nothing to doing a hysterectomy. And she decided for herself, after hearing all of her options, that she wanted to do the myomectomy. Okay, how many myomectomies have you done? Hundreds. Where did you train? I'm an OBGYN. I've done 1,500 Da Vinci surgeries. You know, I mean, I have the background to back it up. I wouldn't say I'm going to take out somebody's gallbladder. I've never done it. I could learn how to do it. I could go to a class and watch it and probably do one. But the question is, do you want somebody that's done 1,500 or do you want somebody that's done 1? I think that's a pretty obvious answer. So again, this has been kind of a diatribe about different things and pellets and vetting. But the basic thing that I'm trying to get to is to talk about you advocating for yourself, to make you aware of the companies like Evexipel and BioT, and basically